Welcome or welcome back to my channel. I am Gabrielle. For those of you who are new, I am bringing a different topic to you all today. I am talking about a more serious topic. As you can tell, I'm wearing my scrubs. It is Colorectal Cancer Awareness Month, and this is a serious topic to me, and I just wanted to educate you all on it. Before we dive right in, I want you all to know I am not a medical doctor, nor am I bringing any medical advice. This is all information that I know and I want to share with you all, just bringing awareness, and the slides that I am using are for educational purposes only. If you have any questions or comments, drop them down in the description box below, but please share this video with your family and friends. The month of March is Colorectal Cancer Awareness Month. That's why you see all of this blue. I am an endoscopy tech at a gastroenterology center here in Georgia. So that's why I want to share my knowledge with you for Colorectal Cancer Awareness Month. Colorectal cancer is a cancer in the colon or your rectum, and it is the second leading cause of death. Please watch until the end of this video because I am paying a special tribute. Colorectal cancer is a cancer in the colon or the rectum. Colorectal cancer can be preventative, and I say that because if you have your routine screenings, then you can prevent this type of cancer. The type of screening that you have is called a colonoscopy, and men and women have this procedure. I will repeat myself, men and women have this procedure. I remember a woman coming to me asking, do women have this procedure? Yes, hence the word colon in colonoscopies. It's shocking, but some animals even have this procedure because they have a colon. During the procedure, there is a colonoscope that goes inside your rectum and examine your entire colon. That's what a colonoscopy is. The age to start having this procedure was 50, but now it has changed to 45 for everyone, although colorectal cancer is higher in African Americans. Now, I will share a diagram just showing you what the inside of your colon looks like, but the end of the colon is actually the beginning of your colon. Your rectum is the end of the colon, but since your doctor has to enter your colon through your rectum, he's going backwards to get to the end, which is actually the beginning, and you will understand what I'm saying once you see the diagram. But your colon actually starts on the right side. It starts with the cecum, moving up to the ascending colon. Then you have a turn, which is your hepatic flexure, moving to your transverse colon, which is your mid colon. You have another turn here, which is your splenic flexure, moving down to the descending colon, curving to the sigmoid, and out through the rectum. It's interesting, huh? Very interesting. But it makes sense, ascending, transverse, descending, going down, curve to the sigmoid, out to the rectum. The main points. So this screening is very important because, as you can see, the doctor is able to go in and actually view your colon. There is a camera at the end, and there is a light as well at the end of the scope. Another screening besides colonoscopies is called a Cologuard test. I know you have heard of the Cologuard test while you're watching commercials or riding in your car listening to the radio. In my center, we only do colonoscopies. Now, the one thing I will say about this test, if you do take it, there are false positives with this test and there are false negatives. Now, I can't speak in detail about this test because my center only does colonoscopies, but I will tell you it is a test that is done at home. Now, this test detects polyps. I will explain what those are a little later. But the thing about this test, once you submit the results to your doctor is going to tell you to come in and have a colonoscopy. And that's good because, like I said, colonoscopies, you are able to go inside your colon and see if there is some polyps or if you have cancer or something's going on in there. But you can speak to your doctor about both, and whichever you feel comfortable doing, then you have an option there between colonoscopy or Cologuard. But with the Cologuard test, if there is a detection of something going on inside your colon, your next step is going to be a colonoscopy. Now I'm going to explain to you what colon polyps are. Colon polyps are precancerous growths or clumps of cells that can potentially turn into cancer. That's what we are actually looking for when you are having a colonoscopy. We are looking for polyps within your colon. Colon cancer occurs in 1 in 20% of people. Some may not have polyps while others will have them. But if you do have a polyp, you should not be alarmed. That's the reason why you came in. And not all polyps are precancerous. The first time you come in and have a colonoscopy, 30% of women will have colon polyps, while 40% of men will have colon polyps their first time. But polyps are common. That's why I say do not be alarmed if your GI, which is your gastroenterology doctor, if he or she tells you that you have one or some. That does not automatically mean that you have colorectal cancer. Most of the time, colon polyps are harmless and they do not cause any symptoms. That's why it's very important to have your routine screenings. And my job as an endoscopy tech is to work alongside my doctors and remove the colon polyps if we see any, or take biopsies if we need to with your small tissue samples of your colon. Based on your findings and or family history, that will determine how often you need to have your colonoscopies. Next, I'm going to move into risk factors. As I mentioned earlier, the start of your colonoscopies is at age 45, but there are factors that come into play where you may need to have your colonoscopy earlier than 45. And the first is family history. Those who are at risk of colorectal cancer are the ones that have a first-degree relative or 2 second-degree relatives. A first-degree relative or 2 second-degree relatives. So right now, based on the current guidelines, although they roughly change, you will come have your routine screenings every 5 years if you have a family history of colorectal cancer. If they have colorectal polyps, then it could be every 3, 5, or 7, just depend on the number of polyps that you have. And it also depends on if your polyps are precancerous or not. So if you do not have a family history of colorectal cancer or a family history of colon polyps, then your routine screenings will be every 10 years. Every 10 years if you have no findings, meaning no family history of colorectal cancer or no colon polyps. Now, remember me mentioning how some people may have to come in earlier than 45 years of age. I say that because if you have a family history of colorectal cancer, you will have to come in 10 years sooner. So, for example, if you have a mother or father that had colorectal cancer at age 45, you will have to start coming to get your colonoscopies at age 35. So whenever they were diagnosed, you have to come in 10 years earlier. I hope that makes sense. Some other risk factors are consuming a lot of alcohol, smoking, obesity, and having a poor diet. I know the information I'm giving you can sound alarming, but that's why I am bringing awareness to you so you know and you can have your routine screenings like you're supposed to. I want you to feel comfortable about this procedure, so I'm going to share with you some prep information. Before you have your procedure, you must be fully cleaned out. You have to be fully cleaned out. I cannot stress that enough. If you are not clean internally, how do you expect us to see inside? This is a colonoscopy, which is different from colonics. I have to explain that to a lot of people. A colonoscopy, you have to be fully cleaned out, and your colon is about 5 feet long. So just imagine. It's a lot of cleaning out that needs to be done before you can come in. One colon prep that we give out a lot is the Miralax and Gatorade with the Dulcolax pills. And another is the Go Lightly. Whatever your GI doctor prescribed for you, make sure you take it. Read all of the instructions first. Thoroughly read all of the instructions first. I cannot stress this enough. Then buy everything it tells you to purchase, unless you have like a prescription that you get sent to your pharmacy. Take it step by step. Don't miss anything. Those of you who have high blood pressure, I'm going to stress this to you. Take your blood pressure medication unless someone tells you not to, even though they should not. I know for a fact at my center, take your blood pressure medication. Read the instructions in its entirety. Do not skip over any information. Whatever is emailed to, if something is emailed to you, text to you, read it. We are not just sending information for our own benefit. It's for you, to help you the day of your procedure. You do not want to start a prep and you have to get sent home. A prep meaning preparation to clear your colon so we can see inside. You do not want us to skip anything or miss anything. So that's why we tell you to make sure you fully cleaned out so we can see in there, or else you will have to repeat the prep and come back. You don't want to go through all of that. You don't. So read the instructions twice if you need to, 3 times. Once you start your prep, which will probably be in the evening, but there is a specific time that you have to start your prep, stay home, okay? Do not eat any solids. Do not eat any solids. Clear liquids only. If you hold it up and you can see through it, then you can consume it. Don't go home trying to parade anything like baby food. Do not do that. Don't be like, oh, well, you said solids. Don't y'all think outside the box with this, okay? All right, but no, seriously. If it's clear, then you can have it. Jello, a popsicle, let's see what else. Oh, a lot of people do the chicken broth. You can have that. Now, if you have the Miralax and Gatorade prep, they will tell you the colors that you can have and colors you should stay away from. I am stressing to you, do not buy the Gatorade that is red or purple. Do not do that. The reason is we can mistaken that for blood in your colon. Like green is fine. Some people do the clear, the blue, the light blue. Some people do yellow. That's fine as well. Just stay away from purple and red. And I can tell you now, you're not going to get any rest. If you get hours of sleep, then I can tell you now you're not going to be clean, because the first thing I hear my patients say is, man, I didn't get any rest last night. Yeah, you're not going to. You will be running to the restroom. So once you start this prep, do not think you can leave the house, okay? You can't. You might as well stay by the restroom and get comfortable, because you were there until the next day. I'm not going to say the entire time, but you need to have at least 5 to 10 liquid bowel movements. And you need to be clear when you come in. Now, I say clear, but it's more like a yellowish color. No solids, nothing in there. I don't want to see brown, then that means you're not clean. So if we ask you, what time did you finish your prep and what color was it the last time you went to the restroom, you need to be able to tell us that. Not, oh, I don't know, I didn't look. You'll know if solids is in there or if you are fully clean out. You will know the difference. So, and I will tell you all, please be honest with us when we ask you questions in pre-op, especially with this type of procedure. Please be honest. I'm going to stress that. We are going inside your body, meaning we will see. So don't tell any stories. If we ask you if you ate, be honest and say, yes, I ate this. If we ask you what color it was, be honest. Because if you don't, we're going to abort the procedure anyway, and you are going to have to start it all over again. Now, the day of your procedure, I can tell you the worst part of having a colonoscopy is the preparation for the colonoscopy. Of course, if you've never been put to sleep before, then yeah, you'll be anxious. But the worst part that I'm telling you, and I know for myself, is the prep. That's torture. Not eating. Torture. Turn off the TV. Don't be around someone when they're eating. Now, to make you feel even more comfortable, I'm going to describe to you the day of your procedure. Well, I can tell you that's how it's going to be at my center. Oh, I forgot to note that most of these procedures are done in an outpatient setting, like where I work. They are done in outpatient settings. You come to us, you check in. Once you get to pre-op, you are going to undress. You'll have a gown. I'm telling you now, open the gown to the back. That's the only way we can access your colon. Then the nurse will start your IV, because you are given fluids during the procedure, and your sedation is administered through your IV. Now, your deep sedation, it is called a deep sedation because you don't remember or feel anything. That is normally propofol. I know that's what all of our centers give, propofol. I'm explaining this because I don't want you to be afraid, because some people are nervous to get put to sleep, but it's not like you're at the hospital. It's propofol, but you're breathing on your own. You're getting a nasal cannula through your nose, which is supplementary oxygen. Once you are given the propofol, you go off to sleep. You only get enough so you don't remember or feel the procedure, and then you wake up on your own. But once you are asleep, we start the procedure. The procedure, guess what, you all? The procedure is only about 20 minutes long, give or take, depending on, if you have any findings, of course. But it's only about 20 minutes. That's it. Some people feel like they slept a lifetime or not long enough. But I will mention that some people do this procedure awake. You have an option to do that. I know I wouldn't, because like I mentioned earlier, your colon has sharp turns. So it all depends on your pain tolerance. A lot of people do stay awake for this procedure, and they do fine, because you have to think about back in the day, you didn't have this type of sedation. So they had no choice but to be awake. They were given a medication that made them feel comfortable, but it wasn't like the propofol where they were asleep. Some people just want to watch on the screen, and that's perfectly fine. Just talk to your doctor or your nurse and let them know in advance that you want to watch the procedure and you want to stay awake. But after your procedure, you will go to recovery. We'll monitor you and you'll get dressed after that. It's simple. It's a simple procedure, and there's no need to be afraid. Just have your routine screenings like you're supposed to. Please, I am stressing that. I have explained everything in detail. You should not be nervous anymore. Thank you so much for watching this video. I hope you all found it very informative. Please share this video. Now it's time for the special tribute.